Hey, Colleen Kupka here with Rejuvenate Hormone and Weight Loss. I hope that you are doing good. I like to do these videos, although sometimes I don't. I just did two that I didn't do the right way, so now I'm repeating it, so we'll see if I do. Anyway, I like to come out and talk about hormones and weight loss, and I also like to break down myth, as there's just so much out here, and it can be so confusing, as a woman, as a man. You can read some stuff on the internet and it just is incorrect. Or you can walk into your provider's office and they're not trained in hormones, and they will give you misinformation and possibly scare you and confuse you more. The reason why I just said that is that, let me tell you about an experience. I had a patient call in just asking for information on hormones, stated that she was confused, from the stuff that she hears maybe from her friends or online. And then she walks into her physician's office and she's 65 and is wanting to be on hormones. She's concerned 10 years out. Well, that's fine. You could be on hormones at any time of your life. But at any rate, wanted to talk to her provider about being on estradiol. And the provider basically, I don't know if this is exactly what she said, okay, just so you know, said that, yeah, she would order her an estradiol patch, but then she really needed to be concerned about stroke. First off, that's just crazy. There is no clinical data to support that. But yet, this lady, out of fear, she walks out of there in fear and thinking, talk to her husband and should I be on it? They planned on traveling. They didn't want to deal with a possible stroke. So where does this all come from? Most often you'll hear the comment of something like, well, you could have a blood clot, heart attack, and stroke. Nothing to support it. They don't know it because they haven't been trained in hormones. Unfortunately, the schools today do not talk about it. It is the most missed thing. But where does it come from? So a long time ago, there was a study called the WHI, and it was actually published in 2002, 2001. And it was a study that really wasn't set up the right way. Tons of stuff in it that just shouldn't have been. But what came out of it with, the study not really being looked at before it was released and the media hype, it just took off and did so much damage to women. So let me tell you a little bit about the study. So in this study, there were two groups. The first group, or one part of it, women had no uteruses. The second half, or the second group, the women had uteruses. So the group that did not have any uteruses, they gave those women Premarin. So what is Premarin? It's an estrogen, and it comes from a pregnant mare, it's urine, and it's dried up and put into, tablet form or whatever. And it has many foreign estrogens in it, not like our own, not like estradiol. The other women that had uteruses, what they did is that they gave them Premarin and also progestin, which is not progesterone. It is synthetic. Our body does not make progestin. But if you're on estradiol, it's really important that you're on a progesterone. So real important. We've made progesterone our whole entire life, okay? So at any rate, what happens though in that study, the women that were on the estrogen and the progestin, when those two drugs or hormones mix together, progestin, synthetic, with estrogen, it can cause an inflammatory response. And so what you get out of it could be, blood clots, heart attacks, strokes, breast cancer, that kind of thing. So there were some issues in that study with that side of it. Nothing with the estrogen, nothing. And even at that, there were only 30 out of 10,000 women that had issues. What they thought was a stroke, it wasn't. They resolved. It was a vascular issue. So when I hear these kinds of comments, I know it comes from a provider that's never been trained in hormones. And unfortunately, they're giving their opinion, okay? Not good. They need to know the studies. And when they're making those kind of comments, they don't. There are many studies with estrogen in it, estradiol, with no problem. And none of them have had these issues. The other thing that she wanted to give her transdermal patch, it doesn't carry consistent levels. It also is not cardiovascular protective. Oral estradiol is. And also, actually, there is a slighter higher amount of blood clots, I think, with transdermal, believe it or not. But neither here nor there, this is why estradiol is important for us as we age, right? As we enter menopause. Our number one risk is cardiovascular disease. As your estrogen goes down, your lipid levels go up, which can cause your arteries, right, to clog, and eventually you having a heart attack. Also, maybe dementia, right? It protects us against dementia. It protects our heart. It protects our bones. And now it's being found that it's breast protective, unlike we're hearing out here. So many studies, oral estradiol, nothing with blood clot, heart attack, or stroke. If you have a provider that tells you this, be courteous, kind, and just say thank you, and know that they're not your hormone provider. Find somebody that studies hormones. And when I say studies hormones, I mean studies hormones. That they are training over and over again, not just a one and done type of thing. Because there's just so much information and so much clinical data, and things change. I'm thinking, so I hope that I cleared that up, and I hope that if you ever hear this, you know that it's just not that, and that you need to protect yourself, and us women really do. You know, and the internet too is just, there's so much myth out there, it's unreal. You can have opinion papers, so you got to watch out with that. You know, retrospective studies where they have no idea what really was going on with that person taking the drug or not. So get hooked up with somebody that's good in hormones. If you want to, check us out in Scottsdale. Check out my website, rejuvenatemyhormones.com. And I hope this information has helped you. And actually, probably this is a better thing that I did this for the zillionth time, because I'm come down a little bit. I get a little riled up when I hear things like this. Anyway, cheers to rejuvenating your hormones and wellness. Okay, take care.